Hey folks, welcome back to Indaba Africa. This is Chris coming to you from central Pennsylvania once again. No, not central Ohio. For those of you who follow the channel, you know that last week my mother's health took a turn for the worse, and I drove the 600 kilometers from central Pennsylvania to central Ohio to see how my mother was doing. Visit her in the hospital on Saturday, Sunday, and again Monday morning before I departed to return back to Pennsylvania in what I now term as escape from Ohio. That's right, ladies and gentlemen, the state where I was a resident from 1978 until October of 2019. I remained a resident of that state, actually from 1978, to be honest, from 1978 until October 2019, where I was a resident, where I paid income taxes, where I voted in each and every election since I was first eligible in the spring of 1983. Ohio, where I have been a long time a resident of. Disappointed in what's happened this week, and let me explain to you what I mean by escape from Ohio. Well, the governor, the Republican governor of Ohio, has issued a curfew, or will be about to issue a curfew, I should say, that will take effect on Thursday, November 19th, and last for 3 weeks exactly, because apparently that's the magic number. 3 weeks solves the COVID crisis. Remember, 2 weeks to flatten the curve, the summertime to stop the surge, and here we are again, and now 3 more weeks of our lives stolen from us by callow politicians. And yes, I include Governor Mike Dewine in my list of callow politicians. This graduate of Miami of Ohio University didn't go to real school like Ohio University. Went to Miami of Ohio. For those of you from Ohio, you'll get the rivalry there. But this graduate of Miami of Ohio pushing ahead with callow political decisions that have no bearing whatsoever in science or epidemiology. So this is what he says. Retail establishments need to be closed and people should stay home. A curfew requires most retail establishments to close from 10 p.m. to 5 a.m. So people are supposed to be home and not out and about on the streets. The curfew order, which, as I said, is yet to be released, does contain exemptions for groceries and pharmacies, but it forbids inside dining in restaurants after 10 p.m. It will allow takeout, delivery, drive-thrus, and continue throughout that period. Huh? So restaurants have to close, but you can go through drive-thru. Sounds a lot like central Pennsylvania, where I had not been able to dine in a restaurant since this nonsense started with the big bad faux governor here, Tom Wolf, shutting down our businesses and driving our businesses and our restaurants into bankruptcy, out of business. Dewine said the curfew does not apply to people who need to go to work or travel for emergency purposes like going to the hospital. Okay. And what if it's a routine visit to the hospital because your parent is dying from cancer? Does that count? Governor Dewine? Gee, I wonder. He said, our idea is to carve this time out. That in and of itself will reduce our contacts. Now, here's the thing, folks. In Ohio, violating this order is a second-degree misdemeanor, which carries a penalty of up to $750 per incident or 90 days in jail. So the state of Ohio will seek to take your freedom because you violated a curfew, which on its basis is questionable to begin with, the constitutionality of it. We've seen, of course, famously in the state of Pennsylvania, Governor Wolf, his actions during the lockdown were declared unconstitutional. And so what has he done? He's driven on violating the law each and every day. We've yet to see anyone rock up at the Harrisburg State Capitol building to place him in handcuffs and arrest him for violating the Constitution. He's just allowed to do it willy-nilly. And he continues now. We have rumors that the governor is about to impose the same sort of draconian nonsense here in Pennsylvania that Governor Dewine is envisioning for Ohio. Dewine said he doesn't expect law enforcement people to pull people over for being out after 10 p.m., but this will give them a tool to confront people who gather in groups. God forbid you violate the Constitution. Wait. The Constitution guarantees freedom of assembly. Huh. So what law are you violating? No law, just some dictate from a governor. Once again, if you can slow these contacts down, that's going to go a long way to slow this virus down, the governor said. This virus only lives when it goes from one person to another. Well, thank you for that deeply scientific thought you got there, Governor Dewine. Those of us who know something about epidemiology and viruses, we never would have figured out that it only survives by going from one host to another. That's truly rocket science. Thank you for your contributions to the scientific world, Governor Mike Dewine. Take these people seriously. No shutdowns, just a slowdown. That's what the Lieutenant Governor John Husted said. Anyway, currently Ohio has 3,648 people hospitalized for COVID-19. 897 of them are in the intensive care units with 441 people on ventilators. Folks, let me put this in perspective for you very quickly. Ohio, one of the larger states population-wise in the United States, has 11.7 million residents. 11.7 million residents. 1% of that would be 116,900 people. So if 1% of Ohioans were in hospital, that would be 116,000 people. But actually, the total is 3,648, or 3% of the 1%, an infinitesimal figure to say the least. And just 897 people are in intensive care. 441 Ohioans are on ventilators as a consequence of COVID-19, or so the authorities will have us believe. But we know they're questionable statistics and how they attribute other causes to COVID-19 and claim COVID-19 is the cause of death. But let's just accept their figures to be 100% accurate and say that 441 Ohioans are currently on ventilators. That means that 11,689,559 Ohioans are not on ventilators. That means 11,689,000 Ohioans are not in intensive care. That means 11,685,000 Ohioans are not in hospital because of COVID-19. Do you see the picture here, folks? Do you see the picture here? Yeah, almost no one is affected by this. Now, I'm not trying to trivialize those who are in hospital, those who are dying. I just came from a hospital. It's quite a tragic situation. But this hysteria is off the charts, ladies and gentlemen. It's off the charts. Well, let's put this in a little more perspective. John Barker, who's the president and CEO of the Ohio Restaurant Association, says the organization's board of directors support the curfew. He emphasized most restaurants are complying and even exceeding the state's coronavirus guidelines while dealing with heightened cost and far lower sales than normal. We think it's the right step at the right time, Barker said. It's going to let Ohioans do their part without having what we thought would be an immediate disaster effect in restaurants and thousands of employees. Really? Really? What do the members of the Ohio Restaurant Association themselves have to say? What do you think they have to say? Yeah. You see, last week, Dewine floated the idea of closing bars and restaurants once more, like they did in the summertime, if the COVID-19 surge continued. But he heard a flood of opposition from workers and owners of restaurants and bars. So why is the Ohio Restaurant Association going along with this? Why do they think this is a good idea? It seems as if many of their members, or those who aren't members of the Ohio Restaurant Association but are involved in the business, are not interested in this nonsense. This is ridiculous. Deep state nonsense. Back in July, the Ohio Liquor Control Commission passed a rule banning the sale of alcohol after 10 p.m. and requiring that all patrons finish their drinks by 11 p.m., 2300. Now, all of those bars and establishments, restaurants that serve alcohol will have to be down entirely by 10 p.m. You're taking yet another hour away from them. So people have to stop serving drinks at 9 p.m. Who goes to a club at 9 p.m.? Seriously. People don't show up till midnight. You've already messed that up. So they're excited about this because Ohio has experienced an increase in people in the hospital. So on the 13th of October, the governor says 1,000 patients were in hospital with COVID-19. By the 5th of November, that was 2,000, and just in 1 week, it's increased to 3,000. A dramatic change. So here's an idea, Governor Dewine. Why don't you take actual, prudent, reasonable steps to stop the spread of COVID-19? Instead of this feckless, bizarre, this can be open, that can be open, you can do this, you can't do this, we're going to surge, we're going to slow down, we're going to do this. How about you do this? How about you start isolating the vulnerable? And Ohio has a large elderly population. Why don't you isolate the vulnerable, which would be the elderly and those with underlying conditions like type 2 diabetes, hypertension, high blood pressure, cancer, asthma, things like that. Why don't you isolate those people and make these recommendations for those people? Or better yet, why don't you set aside times for those people to go to shops exclusively so that they're not exposed to people who are healthy and asymptomatic? Trust me, if you walk into a Kroger's in Central Ohio and you see someone hacking a lung away, you're going to stay away from them and anything they've been near. But asymptomatic young people who are more likely not to exhibit symptoms of this virus, yet carry it around with them and shed the particles, yeah, there you go. So how about you protect the vulnerable instead of this stupidity? This is very disappointing. I voted for this guy for Senate and for governor. Very disappointing. Very disappointing. Yeah. Ohioans, Dewine called on Ohioans to limit their outside contact to one person per day. Are you serious? Governor Dewine, I was just in Ohio for 3 days. Do you know how many people I saw? Of course, I wore a mask and I kept physical distance from people when I was outside exercising. But do you know how many people I came across in that time? Hundreds of people. You want to contact trace those people now for me? And make safer choices for themselves and others. Yeah, well, I did make safer choices for myself and others for 8 months. And what has it got me? A destroyed economy. And a lunatic, senile, creepy, failed senator and disastrous vice president apparently elected as president. That's what it's got me. This orange man bad syndrome and the use of this virus to get Donald Trump hounded out of office by people who are too uninformed to take the time to actually learn what happens in a federal system. That's what it's got me. He's telling people to avoid parties, wearing masks to go to church and other gatherings, and planning out store trips to reduce exposure. Oh, well, thank you for all that. Thank you for the paternal advice there. Seriously, folks. Let's also put this in a little bit better perspective. Okay, this is from the statistics for those who have died, the mortality rate from this. So let me put this in perspective, folks, for you. Ohio has had 494 deaths per million population for COVID-19. A few other states, big population states, and states neighboring Ohio, and let me just tell you, New York, 1,751, nearly 4 times, 400% as many deaths in the general population as Ohio. Texas, 701, nearly twice as many deaths in the general population as the state of Ohio. Illinois, a neighboring state, 893, twice as many. New Jersey, 1,885, nearly four times as many as Ohio, and then some. Pennsylvania, a neighboring state just to the east of it, where I live, 738, nearly double the number of deaths per million as Ohio. And Indiana, on the other side, 746 deaths per million. All of these states well in excess of what Ohio has achieved. So why are you freaking out in the state of Ohio? The numbers of people being hospitalized isn't the issue. The number of people dying is the issue, if that's what you're talking about. But Ohio is freaking out over this. Folks, a little more data to illuminate this particular story, which is very disturbing what's happening in Ohio. According to the Centers for Disease Control, 2018 mortality statistics for Ohio, right? We've had a total of, what's the figure here, 5,772 deaths attributed to COVID-19 in the state of Ohio in the course of nearly a year. In 2018, 29,220 Ohioans died from heart disease. 25,164 Ohioans died from cancer, something very close and near to my thoughts now with my mother suffering in hospital. 7,755 Ohioans died in accidents, includes traffic accidents, of course. 7,518 died from chronic lower respiratory diseases. 6,599 died from stroke. We have yet to put the COVID-19 mortality onto this list of top cause of death. That's 1, 2, 3, 4, 5 cases. And finally, here we come in. At 5,772 this year, COVID-19 would be the 6th highest cause of death in the state of Ohio. Alzheimer's, 5,391. Diabetes, 3,845. Influenza, 2,887 in 2018 in Ohio. Kidney disease, 2,202. And septicemia, 2,078 deaths. So the number of deaths attributed, and I don't even trust these statistics for even a remote second, but those attributed to COVID-19 would make this the 6th largest cause of death in the state of Ohio this year. And as I mentioned, Ohio has done remarkably well when it comes to fatalities, mortality with COVID-19, having half the rate of neighboring states and just a quarter of the states most deeply impacted by this. So what exactly is going on here? Why is Governor Dewine telling people to stay at home, issuing a curfew, shutting down restaurants and businesses, driving Ohioans into poverty just before Christmas? What's this all about? Well, folks, it's hysteria. It's paranoia from people who have no concept of infectious disease, how infectious disease works. Of course, we see the very scientific description here by the governor explaining to us that, of course, it passes from one person to another. Ooh, thank you. Thank you very much. I'm almost tempted to watch Monty Python. Dead, bring out your dead. Bring out your dead. Good God. Seriously? This passes for governance? Lieutenant Governor Husted and Governor Dewine ought to be ashamed of themselves. This is disgraceful, and I am fortunate to have escaped from Ohio. And I feel badly for Ohioans who will now suffer yet again in a state in which people are absolutely batshit crazy, freaking out over this virus, and not even taking the steps that are appropriate to reduce the spread of the virus and contain it as best as possible. They're not going to wipe it out. They actually think they're going to wipe it out. They're smoking crack cocaine. Get serious. And while you wait on a vaccine, people will get sick and die because your useless attempts to stop the virus. Protect the vulnerable. Let's genuinely get serious about protecting the vulnerable for once. Then this other advice is nice. People don't have to take unnecessary risk. But you had 2 weeks to flatten the curve. It didn't do anything. You had the summer to stop the surge. It didn't do anything except destroy our country. Thankfully, at least Ohio didn't turn its back on the president, who did more than any chief executive could have done in a situation like this, while governors and mayors around the country sabotaged the advice of the Centers for Disease Control and the National Institutes for Health. You know, famously, Bill de Blasio, come out to Puerto Rican Day Parade, come out to Haitian Day Parade, ignore those xenophobes for the CDC and for the White House. Trump's just a bigot. You ignore him. Nancy Pelosi, come hug a Chinese. Come hug a Chinese. Helping spread the virus while they're ignoring CDC regulations. And then, hysterically blaming Donald Trump for the spread of the virus that they themselves were the reason it spread, as well as Andrew Cuomo and Tom Wolf putting COVID positive patients into nursing homes. Talk about witchcraft, Muti. Talk about Salem witch trials. Are we going to have Salem witch trials? Is that what's next here? We're having them already on social media, folks. Witch trials, essentially. Anyway, this is my escape from Ohio video. Very disappointing to have been claimed to have been an Ohioan since 1978 until 2019. I'm embarrassed to admit that now, if this is the kind of governance that we have in the state of Ohio. And I thought that Dick Celeste was bad for Ohio. My goodness. My goodness. Ladies and gentlemen, if you're not a subscriber to Chris Wyatt Africa, I ask you to take a second to consider becoming a subscriber. It's free. Just smash that subscription button right down there. Be sure to toggle the bell icon to get notified of any updates to my videos. And then you can watch content from live interviews with special feature guests like Dr. Peter Hammond from South Africa and many other interesting folks around the world, including this week Blaine Scully, former USA Eagles captain for the 15s for the national rugby team. He'll be on the channel this week, as well as former congressional candidates Dasha Pruitt, Earl Weber from Los Angeles, Jamaican immigrant to the United States, Dasha, a Russian immigrant. We bring lots of entertaining, interesting folks on the channel for you to listen to. And I think you'll find it interesting here. The content is focused on Africa, but we also do politics of the USA, Rugby Ascendant with a rugby segment, and now my new segment, which includes previous videos focused on space, something along the lines of Divine Cosmos or something like that. I'm still in the process of naming it. But thanks for your time, your patronage, and your support for the channel. Be sure to smash that like button before you go, because that drives viewership. And for some reason, YouTube is blocking people from liking the videos. I have no idea what that's all about. Some people can, some people can't. So if you can't do it on your mobile, switch to your PC. If you can't do it there, switch to your tablet. Give it a shot. I thank you for your help on that. God bless, and have a good evening. And here I am, a survivor of Ohio. I escaped from Ohio. It's sad to say that a wonderful state, which represents the country in so many ways, a Midwestern state, and it is a place that I am fortunate to have escaped from before the governor, the Republican governor of Ohio, imposed these draconian, fascist, liberty-crushing restrictions. Take care, folks.